Hi, this is Dr. Adajar from XSculpt. I'm doing a video today on how to inject your Sermorelin. We will be doing a video on Sermorelin itself, and at the time this is just the technique of how to use it. Now, here's our Sermorelin. Okay, here's our Sermorelin. It's very important to know a couple things. That this is extremely fragile. You should not jar it or shake it at any point, because what it can do, it can inactivate the sensitive amino acids that are in here. Number one. Number two, it has to be refrigerated. They say that you can leave it out for up to 8 to 16 hours, and there should be no problem with it, but best keep it in the refrigerator at all times. So do not jar it, do not shake it, and refrigerate it. Also, you should know you cannot travel on an airplane with this without documentation from your doctor. So if you're going on vacation and you want to bring this with you, make sure that you call our office and we will write you a note that you can take on an airplane so you can travel with it. However, remember, you got to keep it refrigerated, so you have to put it in some sort of ice box or something. All right, so about the procedure on how to inject it. Okay, so we like to use 15 milligram vials. You may have a 9 milligram vial, which there are some videos already on YouTube on how to inject 9 milligram vials, but today, for today's purposes, because 15 milligrams is the most common one that we prescribe, I'll be using the 15 milligram vial as an example. Okay, so here's your 15 milligram vial. You'll need a 15 milligram vial. You will need this, which is bacteriostatic water. You will need a 10 cc syringe with needle. You will need your insulin syringe with its needle right here. Insulin syringe and its needle right here. And alcohol pad, and then we have it over here. You can't see your camera, but a Sharps box, or like a biohazard container, so you can put your needle in when you're done. When you order it from us, all this stuff should be provided to you. If you do not have any of these components, please let our office know, and we will get it to you as soon as possible. Okay, so that being said, the first part is to draw the bacteriostatic water. Now, in a 15 milligram vial, we will use half of that, which is 7.5 milliliters of this bacteriostatic water. Okay, so oh, by the way, I already did, but it's very important to wash your hands before you touch any of this. So I'm using a one of those hand sanitizer lotions. Okay, so I'm going to pop this cap, okay, and then using the big syringe, the 10 milliliter syringe, I'm going to withdraw 7.5 milliliters of water, of bacteriostatic water. Now, you do not have to be gentle with this, but 7.5, which is half of 15, okay? The reason why I say that is because if you use a 9 milligram vial, you use 4.5 cc's or 4.5 milliliters, but in this case it's 15, so I'm using this much. Okay, so that's step one. Okay, step two, you take your you'll see there's a powder inside here of the Sermorelin. Okay, you're gonna pop the cap on this, and then here's a trick: you do not put it in and then squeeze the water directly onto the powder. You may damage the product. So what I do is I will inject, and then you'll see, because of the suction, you'll see that the saline is going, the syringe is going down without me even touching it. And I'm putting it against the side of the vial. I'm not hitting it directly. Okay, there. Now it's all done. Okay. Good. All right. So now that that's done, so now you can see that the white powder went away and it's now clear. I'm going to just gently turn it like this, I'm not going to shake it, you know, I'm not going to jar it. I'm just going to just swirl it around very gently, okay? So now your product is mixed. So after you use it, you put it in the refrigerator. Now, okay, so now I have my product. Here is the insulin syringe with its needle, okay? Now what I'm going to do, so for men, our starting dose is 300 units. For women, 200 units, unless I tell you or another XSculpt doctor tells you otherwise. That's kind of the standard starting dose, okay? So I'm going to do 300. Now, for 300 units, you want to take out 150, I'm sorry, for 300 units, you want to take out, for 300 millicentigrams of the product, you want to take out to the number 15 on your insulin syringe, okay? So 15 will equal 300. All right, so I'm withdrawing to 15 right now, just very gently. Okay, so I'm at 15. So the insulin syringe is at 15 units for a dose of 300. One more time. The insulin syringe is at 15 units for a dose of 300. Women, they would draw to 10, okay, for a dose of 200. So again, everything is in half here. So, kind of half. 300, 15, 210. Okay, so that makes sense. That can get very confusing, okay? Now, for the injection part. So this is where we use our alcohol pad. Now, I'm gonna lift up my shirt, so don't laugh. So I'm gonna lift up my shirt here. So we want to do it in one of the fatty layers around the belly button, around the umbilicus, around here. Okay, and we would like to rotate it every day. So I'm gonna choose an area in my fat layer right here. Okay, so I wiped it with the alcohol pad. I'm uncapping the syringe. Okay, this is subcutaneously, not into the muscle. Okay, so basically what I want you to do is pinch it. 1, 2, 3, ah! Right there. And then I'm injecting. Okay, wow. And pull right out. The needle gauge is very small, so you should not have any bleeding. Okay? That is, and then you're done. Then you throw this away into the sharps container or the biohazard box. This one you can, since you already mixed it, you would also put that in the biohazard box, and then you throw out all your stuff. Once your biohazard box is full, you can bring it to us, and we'll dispose it for you. So a couple of things. So you're gonna put this back in the refrigerator. It's very important that before every time you use it, you should take your alcohol wipe and wipe the top to keep it as clean as possible. Okay, so that's one thing. Another thing, so some other points is that you should, I do recommend you inject it at night, right before you go to bed, because the Sermorelin will help you go to sleep. It'll help you sleep. It'll help provide a more restful sleep by keeping you in that REM stage 4 for a longer amount of time than you normally do. So inject it right before you sleep, and do not inject within an hour of eating, because the carbohydrates and fats in your diet can inactivate the product in your body. So wait at least an hour before you inject. I think, yeah, you can inject it during the morning. However, remember, sometimes some of the side effects of increased human growth hormone can be drowsiness, can be increased appetite. If you inject it right before you go to sleep, you don't have to worry about those two as much. But if it's during the day, then it may be an issue. So that's the video. If you have any questions, you have my email, you have my cell phone. Send me an email, give me a text. Try not to leave it in the comments below, because I don't check those as often. But I hope this answers any of your questions. If you have any other questions, please send me an email or shoot me a text. All right, have a great day. Bye.